Hi, I'm Angelo Rannazzisi, a licensed clinical psychologist with Rittenhouse Psychiatric Associates. In addition to depression, anxiety, and bipolar disorder, I work alongside the psychiatrists and nurse practitioners at Rittenhouse to treat individuals diagnosed with ADHD. Because people are generally more aware of medication options in the treatment of ADHD, I often get the question, what does treatment for ADHD look like and how would I benefit from it? I use a kind of treatment called cognitive behavioral therapy, which put simply focuses on the way that we think and the things that we do, and how these factors interact with the way that we feel. In depression or anxiety, thoughts play more of a causal role. It's easy to see how a person who believes they are not worth someone's time would then become depressed, or how a person who believes others will ridicule them would then become anxious. Thoughts don't play the exact same role in ADHD, but are important nonetheless in understanding a person's difficulty with managing important aspects of their life. I often use an example to something people might be more familiar with. In diabetes, a person's body doesn't produce insulin or produces it inefficiently. And there's nothing that thinking about diabetes differently can do to change this underlying biological reality. However, thoughts and behaviors can play an important role in the management of diabetes. If a person believes that there's nothing I can do to control my A1C levels, you can imagine that this kind of thinking would influence whether or not they take their medications the way that they're directed to, or modify their diet. There are similarities between this and what treatment looks like for ADHD. There are biological realities for individuals with ADHD, mainly that neurological differences in certain areas of the brain are at the heart of the symptoms that define ADHD. And while thinking differently about these differences isn't going to change them, there are many thoughts that individuals with ADHD commonly experience that greatly impact whether they use coping strategies effectively. This could be the belief that you work better on deadlines, or how you expect tasks are just going to take too much work, or how you'll work better if the house was organized first, or how you have plenty of time to get things done, even if you don't, or how you'll never get anything done so it's not worth starting anyway. Now, to be fair, these are thoughts that even those without ADHD have as well, but due in part to the additional struggles that those with ADHD experience in organizing and initiating high-priority tasks, these thoughts can play an outsized role in whether these individuals are as productive and as effective as they would like to be. In addition, the way we think is only part of the equation. Those with ADHD also need tangible skills to help compensate for executive functioning deficits. Sometimes that means improving the skills that are already working for you, and other times it means building new ones from scratch. Whether that is effectively using a planner or to-do list, strategies for reducing distractions, or promoting better awareness of time, these skills can be used in combination with thinking more adaptively and accurately to improve your ability to function. Hopefully this provides a framework on what treatment for ADHD might look like. You can contact Rittenhouse Psychiatric Associates for more information on this service to determine whether the treatment that we offer is right for you. You can visit rittenhousepa.com or find the contact information in our bio for more details on how we can help.